the ladder twisted on the drop cloth a little bit, and it's an A-frame ladder, 12 foot tall, and it fell onto its side. And I fell ribs first, 13 feet off the ground, rib side first. And I, in front of all my patients in therapy, just ate it. First thing I did is I said, holy crap, I've got a pneumothorax and a liver laceration. I'm going to die here, because the pain was intense and I couldn't catch my breath. So I called the local CT place, got a CT of my chest over lunch. And sure enough, I had extensive rib fracturing that was missed during the ER visit on the chest x-ray.
I'm curious if you can recall a specific situation, specific patient where delaying treatment really screwed up the prognosis and the chances of recovery for that particular patient.
Well, I can tell a story about a specific patient named Mark Sokolowski. I don't know about the importance of medical evaluation and advocacy for yourself. We have this nice clinic building, and there's 16-foot ceilings in the building. And there are times when males, females as well, will have the urge to do some remodeling and renovation. And I satisfy that urge by making some subtle changes, et cetera, to the clinic as time allows. And there are some things that I'll say like, gosh, it would really be nice. For example, we've done a little bit of renovation. That wall would be nice to paint. I'll come in on Saturday and paint that wall. But for whatever reason, the 4:30 p.m. patient on a Friday cancels and physical therapy is still going. And I'll say, well, I'm not supposed to be home till after 5 anyway. I'm just going to go ahead and paint that wall right now. And so on one such Friday, my physical therapy was still going in my clinic. It's in the way when you walk into my clinic, there's the main lobby, little foyer, and then we have a big therapy space, and then we've got the front desk, et cetera. And I was painting the front wall, a nice, lovely shade of brown to contrast with the Revere pewter that was elsewhere. Very, very modern. And I had set up the ladder, and I'm 9 feet off. My feet are 9 feet off the ground to paint the top of the 16-foot wall. And patient walked in, and I said, "Oh, hi. Let's just say it's Mr. Smith. Hi, Mr. Smith. Just be careful. My paint tray is over there." And as I turned to say that to him, the ladder twisted on the drop cloth a little bit, and it's an A-frame ladder, 12 foot tall, and it fell onto its side. And I fell ribs first. My ribs were probably 12 feet off the ground, 13 feet off the ground, rib side first. And I, in front of all my patients in therapy, just ate it on that ladder right there. And there was no way to play it cool. My therapy patients came over and like, what the hell just happened? And I couldn't catch my breath. And first thing I did is I said, holy crap, I've got a pneumothorax and a liver laceration. I'm going to die here, because the pain was intense and I couldn't catch my breath. So then I said, okay, I'm breathing, but I'm like horribly shaken. I have this insane pain. And I told my staff, I'm driving home. And they're like, dude, you cannot drive home. Call the ambulance. I said, I'm not driving. I have a high-deductible health plan. I'm not calling an ambulance. So on the way home, I called my wife and I said, I'm going to get home. I just had this horrible injury from a fall.
So you're one of those people that refuse ambulance.
Yes, I got a high-deductible health plan, man. So I'm driving home, and I called my wife. I said, I'm coming home, but there's a chance you might need to take me to the ER. So we get home, and I barely make it out of the car, and I'm like breathing heavily. And I said, that's it. We got to go to the ER. So we go to the ER, and I tell the ER doctor, I said, hey, can I get a CT of my chest and a CT of my abdomen? And he says, well, we can do one or the other. We can't do both. And I said, no, I really need both. I need to make sure, A, I don't have internal hemorrhage and liver laceration, et cetera. And B, I need a CT of my chest to make sure I don't have a lung fracture, pneumothorax, lung contusion. And anyway, they ultimately order one chest x-ray and CT of my abdomen. And they say, good news, you don't have any abdominal bleeding. I was developing this massive flank contusion here. And I said, it's going to be a painful couple of days. And I was thinking also, A, how am I going to continue working? B, did I sustain some head trauma? Am I going to be able to support my family, et cetera? All the stuff that normal people think about when they have an accident. Anyway, 48 hours later, I woke up in excruciating pain. I couldn't get out of bed. every bump on the road to work was increasingly more painful, to the point where I would come into the room and I would sit down with the patient on the stool, and I would be wincing, trying to hide my pain, but the pain was progressively worsening. So I called the local CT place, got a CT of my chest over lunch, and sure enough, I had extensive rib fracturing that was missed during the ER visit? During the ER visit on the chest x-ray. So ultimately then, rib fractures, multiple rib fractures, I'll heal conservatively, etc. But I had an explanation for my pain, and I had an accurate diagnosis as to what my injury was. And so sometimes, doctors are criticized for getting too much imaging in the short term after an injury. And they say, gosh, why are you getting imaging? Well, if I told you the number of patients that had significant chest pain with chest radiographs that initially missed their rib fractures that were ultimately elucidated on CT, or a sternal fracture that was initially missed and elucidated on CT, or a lung contusion, or even a small hemothorax, there have been many, many patients in my practice, and I also am one such patient. And I can tell you that it is when you have unexplained pain that is increasing over 48 hours, you really become concerned that something, dramatic is going on. And I can tell you that in just knowing the diagnosis, okay, you've got multiple rib fractures. Now you know prognosis is going to heal over the next 12 weeks. You're going to wear this this strap. There's some controversy about wearing a strap, but obviously I'm a doctor. I can't take narcotic pain medications to do my job, so I wore a strap. I took anti-inflammatories. I did lidocaine patches, all non-narcotic measures, so that nothing affects my cognition, etc. And there is some comfort in having a diagnosis, because if you don't have that diagnosis, you start to say, what's going on? I'm going bananas over here. My function is markedly decreased. I can't do routine activities of daily living. And so if anything, that experience has taught me, look, there is an advantage to seeking medical care early, but seeking medical care early alone is insufficient. You have to advocate for yourself. You have to say, these are the parts of my body that are injured, because on day one, your day one assessment of yourself may not accurately reflect your symptoms at 48 hours, 72 hours, 96 hours after. And then it's a weekend, and then good luck finding someone to see you and give you care on the weekend. It's taught me aggressively seek care. It's okay to err on the side of additional imaging, because often erring on the side of additional imaging increases your diagnostic specificity, can dictate your care. And so I think, yes, if you are injured, seek care. I can say that with an exclamation point, myself having been through that experience. If you are injured, even if you don't want to call the ambulance, even if you don't initially want to go to the emergency room, even if you have a high-deductible health plan, seek care.
Very good point. And I guess the moral of the story is sometimes it's helpful to get the second opinion, like you did with the imaging place.
That's right.
And also to that, I think people underestimate what adrenaline does to a human body. I know of people who were badly injured and they didn't feel it. That's how I learned how much a lot of adrenaline in your bloodstream can really affect your perception of your own injuries, of your pain. You may have fractures and not even know about it until you look down at your foot.
100% agree. That in that acute post-injury moment, there's some mixture of shock, embarrassment, adrenaline, and a desire that, being naturally optimistic people, we're like, oh, I'm going to walk it off. It can't be anything bad. But sometimes it is something bad. And sometimes medical intervention, timely medical intervention, is appropriate, justified, and necessary.
And also, as a personal injury attorney, what I tell people is, listen, calling the ambulance and getting wheeled out in an ambulance, it's not only giving you the necessary medical treatment you may require, but the ambulance arrival also confirms where the accident happened. If you slip and fall in a parking lot and then drive yourself, you're still in a shock, badly injured, but you drive yourself to the nearest hospital, good luck proving where the accident happened, right? So the ambulance is dispatched to an address which gives your case even more legitimacy.
Yeah, that makes sense. Something I've never thought about or considered, but yeah, absolutely. That seems like a good tip.